And I was going through clothes and books, and there was a book that was in my office called Future Mind, written by my father-in-law on artificial intelligence, but it was published in 1989. Whoa. And yeah, and I'm like, I want to. That's a time capsule, right? I eventually need to read this book. But anyway, we're talking about AI because of Gemini and Note Taker and all that stuff. But Matt Dowling, welcome to the show. Thanks for coming. And since this is your first time here, I want to ask you. I've known you since high school, post high school. I want to get a little bit of orientation. I'll have read your bio in the pre-roll, so listeners will know a little bit about who you are. But I'm also just deeply curious, about how you got to where you are and what you're. So first and foremost, where'd you go to high school?
I went to the Heights, which is right down the street from Montgomery Mall, all boys Catholic school, and
okay.
Yeah, not necessarily the makings of someone that would go do music and startup kind of stuff, but there was a lot of great experiences there, and really small school. And,
what makes you say not necessarily the makings? How so?
It's a school. It's a religious-based school, and there's a lot of really religious families that send their kids there, and it's kind of the place to become a doctor or a lawyer, or that's the track that's sort of expected,
I see.
and do it in a very sort of, live a traditional life. And the more traditional, the better.
Okay. Well, I can follow that. So I'm curious about, so you, when you graduated from that all boys Catholic school, did you take a year or two, or did you go right into undergrad, or what was your story in terms of, because now, I mean, you're a well-educated guy, right? Did you go right into?
Yeah. Well, I went to Notre Dame and studied chemical engineering there, and I was a really good student and had good opportunities coming out. I was a math and science kid. Math and science is what came most easily to me. Humanities kinds of courses were I viewed as a chore, and but I was willing to do the work, and so I did it. So, but I sort of knew I wanted to do something chemistry and math related in college, and so I did chemical engineering. Although I didn't know why I wanted to do chemical engineering other than those reasons. I didn't know anything about the chemical engineering industry other than, ExxonMobil and these kinds of companies were involved in it. And as I learned more about those kinds of job opportunities throughout college, I was like, that's not what I want to do. And I also super got hit with the music bug. I mean, I was already a musician and played in bands and had friends in bands back home. Right. South Bend, Indiana didn't feel very accessible to me as to a music scene going on there. So I would actually go out to Chicago a lot of weekends and go to shows out there. And I'm just like, I'm in chemical engineering at Notre Dame was about 40 students as well. So that's kind of the class you're in. And everyone was getting jobs lined up, and I'm like, I want to play music. And I don't really know what I want to do. Right. And so I ended up becoming really interested in biology and the medical side of chemical engineering, that mixed with this music thing. So I came back to the East Coast to the University of Maryland to do my PhD in bioengineering, and did it with a guy. My research advisor really is chemical engineering by trade, but he had kind of a cross appointment with bioengineering, and his name's Srini Raghavan, and I'm still a research collaborator of his today, many years later, and that was that was a great time. He was a great fit for what I was interested in, and so like grad school became this time of a lot of exploration in scientific research, which I didn't actually have a lot of scientific real research in undergrad. I thought probably like a lot of undergrads think, like, I just need to get good grades and then there'll be like a job for me on the other side of the fence. And that turned out to, I learned that wasn't true, right?
Right.
And part of that not being true is also I didn't really know what I wanted, but even if I really had known what I wanted, it's it would have been really competitive to try to get some of like the premier jobs in chemical engineering. So so that mixed with these different interests, I ended up going to grad school. One of the beautiful things about scientific and engineering grad school, if you're willing to do it, is you get paid. You actually get paid a small salary to do your PhD. And so I sort of viewed it like a job, but for me it was a fun job, and I was really motivated to get research experience that I didn't have. And I wasn't really set apart as an undergrad. Like, I had good grades, but I didn't have any research experience. So I was like, I want to get research experience, and I want to learn about biology and the biological applications of biomaterials, and was also playing in deleted scenes. And I know you know deleted scenes. Deleted scenes started right at the beginning of grad school for me, and that grew while I was, as grad school went on, and I was able to pull it off. I mean,
Let me pause you for just a second, because what time are we talking? What year? When you're in grad school and you're starting to play in a band that's touring around?
2005. Yeah,
okay.
2005.
Yeah.
Gosh, 20 years ago.
Yeah. Yeah. So, okay, let me ask you. So there's a lot of rivulets and pathways that I want to go down. But so first, just what was your what were the research, the applications of bioengineering, or what were you researching in grad school? What was your focus or your interest areas?
Yeah, my key interest was in a field called drug delivery, which that sounds like it's putting things into cars and driving them over police barriers, but instead it's putting small molecule drugs, like therapeutics, into materials to help optimize how they get to where they need to go inside the body, because it's not just about the drug molecule itself, but about getting it to where it needs to go. The classic example is a cancer drug. If you take chemotherapy and inject it into your veins, it goes everywhere in your body, but it's toxic to healthy cells as well as cancer cells. So a lot of the field of drug delivery was based on packaging the drug molecules into small particles that are small enough to still travel in blood vessels, but large enough that they can package drug inside of it, and they would be targeted to tumor cells specifically. So that's the kind of stuff I was working, small particles to be, injected into small animal tumor models, and then gels that control the release of drugs. That's another piece of not just targeting, but also packaging drug inside some kind of reservoir that releases it out at a controlled rate. Because if something just dumps out into an area of use, a lot of the drug is just wasted, or in some cases, if you've got something like a growth factor, if you dump out a growth factor, that could actually cause cancer. Whereas like a controlled release of a growth factor can be used by the body in just the right way to get the effect you want without the side effects.
Okay, and so with a gel, we're talking about like a topical on the skin. Is that?
Yeah. Gel, I mean, a lot of grad school for me was mixing chemicals and making gels in vials. Do I have? Oh, here we go. I have a vial right here. Here's a vial on my desk, and can you see that? Sorry, I need to take it off. There we go. This is a very common like thing you see in in like materials labs as people are mixing these things up and seeing what they look like in vials, and then looking at the properties of it. Like Srini Raghavan was big in or still is big in rheology. Rheology means the study of flow of materials, and this applies to like viscoelastic material, something that's not flowy like water, and it's not a solid material like your desk, but something in between that's sort of squishy. And there's this huge range of how materials can act in the viscoelastic world, and a lot of the research was tailoring the viscoelastic properties of biomaterials to achieve better drug delivery outcomes.
And as you're saying all that, Matt, I'm curious about what animal, you said animal tumor models. What animals are these getting tested with?
Mice in grad school.
Right. Standard, right?
Yeah, that's standard. And really it's kind of unique to get to do any animal research in grad school. A lot of animal research in general, there's quite a bit of regulation around it, and it's expensive. So not a lot of PIs, principal investigators, meaning the research professors, not a lot of them have the funding to actually go do animal studies or set up animal labs. So I was able to do that with that. There was a research collaborator of Dr. Raghavan's at the School of Medicine in Baltimore, and so I would go up there and do animal studies up there.
Okay. Yeah, I'm not surprised. I mean, rodents says that's the classic. All of so much of scientific research is based on rodent models, and so that's great that you had that opportunity, those experiences, and after. So just I guess from a timeline standpoint, I'm going to be kind of jumping all over the place, but where we are with like grad school and we're talking about the PhD section of grad school, or yeah. And so when did you graduate? When did you get your PhD, Matt?
2010.
Okay. Yeah. And so then what was in the biography of Matt Dowling? What happened after you graduated? Yeah, go ahead.
I had started Medcura by that time. It wasn't called Medcura, it was a different name, but I was able to get one small grant to commercialize a company coming out of grad school. And the reason that happened was it related. I was interested in biomedical entrepreneurship. I was in the drug delivery world and going to pharmaceutical kinds of conferences. I read about what does it take to get a drug approved, and what does it take to get a drug delivery system approved, and read the amounts of money that people typically need to raise to build those kinds of companies, which are $100 million or something like that, which just seemed unfathomable to me. But I ended up reading stuff about devices as well, and how there are some medical devices that you can get approved with much less burden, much less testing. And I ended up meeting this guy, John Hess, at the University of Maryland Medical School. He was the head of the blood bank. And the reason I met him is because me and Dr. Raghavan were looking for new research collaborations, largely to apply for grants. And so the thinking was, can we take a chitosan film, which we were doing a lot of work with chitosan films. Chitosan is a natural biomaterial found in the exoskeleton of crabs and shrimp and things like this. And a lot of biomaterials research labs will have chitosan sitting around because it has some basic things about it that are just interesting. It's low cost, and so why not have it around? And but I became interested in the material and was using it for controlled release films and gels, like things like that. And for whatever reason, started looking into the use of chitosan as a covering for chronic wounds. Chronic wounds are things that like diabetic patients have. You get diabetic ulcers, or elderly patients will get this too, like non-healing wounds. And chitosan is this really nice covering that is antibacterial that can like stick to the wound sites. And I went to John Hess in Baltimore and said, hey, what do you, his name was associated with wound kind of stuff. So I said, what do you think about this idea of a controlled release film for diabetic ulcers where we're releasing growth factor into the diabetic ulcer to help it heal? And he looked at what we were doing and he's like, I think what you're doing would be more useful for acute wounds. And I was like, what's an acute wound? And he then started showing us like actually like these videos. He was a former Army doctor and with a collaborator with the Red Cross, and really a blood science guru. And he showed these really bad bleeding videos. So it's stuff he was working on in the late 80s, early 90s with fibrin sealants. And fibrin is what our body uses to clot. When your blood goes through a clotting cascade, you get a final thing that, you know, starts turning black and then scabbing. That's fibrin.
Is that what hemophiliacs lack? Or
Yeah,
have low levels of, or
yeah, hemophiliacs lack certain blood factors that prevent the whole clotting cascade from happening. There's a bunch of if you actually Google clotting cascade, the classic image is like protein 1 talking to protein 2 talking to protein 3, and it's this whole cascade that gets you to fibrin formation. Oh, okay. And the reason it has to be a cascade is because if your body clotted too quickly, then you get a stroke and die. You know, so there has to be a lot of checkpoints before it actually happens. Hemophiliacs are missing one of those factors. So as the cascade happens, it just stops and never gets to the fibrin. So, but no, great question. And you know, that a fibrin sealant is something that could help a hemophiliac stop bleeding. Or it would stop bleeding for a hemophiliac because it gets you to the end point. And so Dr. Hess was working on that with the Army. They actually made a bandage that was really, really good. I mean, fibrin is really, really effective at stopping bleeding. But it's super high cost. You have to extract it from human blood. There's like, you know, viral transmission issues you have to consider. There's other kinds like pathogen related issues you have to worry about with that. So he's like, I think what you're doing would be useful for acute wounds. And he suggested some early experiments that I went and did and were positive. And I also knew that those kinds of products can get regulated as medical devices. So I started putting together a business plan for whatever reason. I guess, you know, I was waiting for an opportunity to try to do something like that, and was, you know, made these really primitive business plans, but knew enough about writing research grants to be able to get kind of a first grant to do some research around the building of a commercial entity. And so that was my job coming right out of grad school. Was I was the CEO of a company that was this rinky-dink little thing, and I was in this rinky-dink little incubator building, and didn't even have a lab at that time. It was just one small office, but I was sitting there writing grants, you know, like there was no tomorrow, and also doing work on the technology still at the university. Then I did get my own lab space and just did a ton of work on hydrophobically modified chitosan. If you Google my name and chitosan, probably the first thing that will pop up is hydrophobically modified chitosan, which means putting these, if you think about chitosan or any polymer is like a spaghetti strand, that's kind of how you have to think about it. We put these little grafts along the backbone that are hydrophobic, or a simpler way to say it is fat groups. So hydrocarbon chains. And what those hydrocarbon chains do is they want, in the presence of water, they want to associate with themselves, right, or associate with other hydrophobic things, and it allows these spaghetti strands to self-assemble into these structures, and that's the core reason why it works to stop bleeding.
Very cool. Yeah, I just would. This might seem like a nonsense detail, but you were saying you were in this rinky-dink incubator. What space are you talking? Was this in College Park or where was this?
Yeah, it was. It's technically on the campus. It was called the Technology Advancement Program Building,
Hmm.
or TAP building for short. And it's still there and houses companies today. And but it's one of those places that, I was I was there for longer than I wanted to be, and so, you know I I've had my fill, so I don't I don't swing by all that often. But I actually did swing by there maybe like a couple months ago because someone was visiting the area and wanted to see what incubator spaces existed, around here.
Yeah. So you mentioned a couple of mentors, sort of mentor figures that helped guide you, on this journey, and makes sense to me. First of all, when you talk about like the statistical likelihood of succeeding in on a certain pathway, and you say, well, if we went a different way with medical devices, there's not as much of a burden, as you say, but it still takes courage to start your own company. I mean, especially as you're like forming it in finishing your PhD. So you take this leap of faith, you follow your gut, so to speak. It wasn't called Medcura at the time. What was the first name of the company?
Jelly, GEL-E.
GEL-E. Okay.
Yeah.
And then when did it transform into Medcura?
2018, I want to say, is when the name change happened. And the reason for the name change is, as people, like, we went from just kind of a ragtag group of scientists to, raising money and corporate people involved. Like, I remember a guy who was chief operating officer at one point. He was just like, a seasoned guy. He was just like, he actually was the one that kind of pushed for it. He's like, I really don't want to walk into partnership meetings and say I work for Jelly. I guess saying it now, like, it does sound kind of funny, but I was kind of pumped on it because, like, there's a lot of people that do research with gels. Like, if you Google the word gel in Web of Science, your computer will explode with the millions of people that have done research on gels. But there's actually very few commercial entities that have actually gone and developed products with gels in a relative sense. Surely there's plenty of gels in you walk to CVS and there's gels of many types, but for like advanced medical applications, there's actually very few gels. And part of the reason is because it's a weird category for traditional testing that you need to do to get like regulatory approvals. Regardless, I liked the name, but I got outvoted. But the technology, we still have a trademark to the term jelly. So jelly is kind of a way to help describe the technology.
Mm-hmm.
So yeah, I accepted the change, but I wasn't super pumped about it at the time.
How many people were there when it was starting out? You were the founder, but what's the size of the group or the team?
There was a couple other grad students that worked with me at the time on the project. They kind of left, and that, going off to do their next things after grad school. But soon after that, there was a guy from Dr. Raghavan's that had done some work at Dr. Raghavan's lab, just an undergrad that was looking for a job, and couldn't find anything. And he knocked on my door. His name was Ian McIntyre, and he was like, "Hey, I heard about what you're doing, and I was wondering if I could work for you guys." And I was like, "Well, we don't really have any money right now, but if you want to get some research experience, you can." And he came in, and it was really me and Ian in the early days, just cranking chemistries, and writing a lot of grants. And it was about 6 months after he started helping out that we got our first like real research grant. SBIR stands for Small Business Innovation Research. National Science Foundation, and yeah, then we just kept going for it. And the way I thought the business, everyone was telling me early on, like, you should go after trauma and military, and that was kind of the first thinking, but it took me a long time to realize that's not that good of a market. And I ultimately developed a lot of different product configurations. That's one of the exciting things about the technology platform. You may hear that terms. You actually can make lots of different kinds of things with it, not just gels, but sprayable foams. Actually, sprayable foams were the big first grants that I got. And that's kind of like a can of shaving cream kind of application where you spray it out of the canister and it foams. But also films, freeze-dried patches, putties. We developed these moldable things that you can mold into weird shapes.
And again, this is all in the biomedical application.
Yes.
Yeah.
Yes.
Yeah.
Yeah. So what ultimately became the first commercial success was a gel in a tube, and that's here. I don't know if you can see this in your screen.
Hold it in front of your shirt there. Yeah, there we go.
It's called Rapid Seal Wound Gel, but you can get it from CVS and Walgreens and Walmart. But we met a distributor called Aso Medical that does all the private label Band-Aids, and they saw what we were doing and really liked the technology. Didn't know what at first conversations were like. They were just interested, intrigued by it, and eventually they were like, gel in a tube. We want a gel in a tube that's kind of like Neosporin, but can stop bleeding. And this fit the bill because it's antibacterial. It's actually probably one of the most interesting things about chitosan as a natural material is it's antibacterial, but it also stops bleeding. And that whole story too. I mean, time unfolds and you don't really know. You think you try to kind of contextualize yourself and the work you're doing in some way, and you sell yourself short in certain ways, and then maybe think you're better in other ways. But even to this day, Rapid Seal Wound Gel, this is one of our first 510K clearances from FDA. And Medcura is the first University of Maryland spin-out company to ever get an FDA approval of any sort, and the first company to get any revenue off of an FDA approval of any sort. And it's also the first bleeding controlled gel in the over-the-counter market. And when I say that, you may be surprised. I was actually surprised as that all unfolded. It's like there's tons of gels for wound treatment kind of stuff that are in stores, but they're not indicated for bleeding control. They're indicated for just covering wounds and that sort of thing. So, so it's the first bleeding control gel, and I think the reason for that is that there wasn't a lot of predicate devices. The 510K pathway for FDA, it's all based on devices that have already been cleared for that particular use, and you have to compare yourself to that. So there weren't really gels in that field, and we were able to sort of make that happen by slick regulatory strategies, I guess. But
and what year was that got approved? And because when you were sharing that story, I was like, yeah, that would be the kind of thing that, you know, on the University of Maryland like magazine that goes out, and they're always like touting, you know, this is the current events or the news or the awards or celebrations. It's like that's the kind of thing that, like, you know, your mom would be like, I'm saving this issue. You know, like
University of Maryland has put a lot. There's been a lot of, you know, a lot of banner waving over the years, and I mean, I'm on the board of advisors of bioengineering at Maryland, and I at the end of the day, I love the university, and they've given me a lot of accolades and done stories on the company and that sort of thing. But it also is not it's a tough place from which to start to spin out a technology company, particularly a life sciences technology company, because life sciences is very specialized, and it's hard to have the right like advisement around that anywhere in the country. There are a few places that it's easier than others, but yeah, I mean, they've given me my props, that's for sure, and I give them props back. And we hire a lot of people out of the University of Maryland, it's right down the street. So yeah, there's been fanfare.
Now, how big's the team now at Medcura?
The total number of employees is low 30s, and we've got a lot of consultants that work with us as well. So I mean, you're talking about 40 people kind of coordinating each and every day on building new stuff. And so we've got a few commercial products now, but then it's all about the next thing, and we're developing internal surgical products now, so things to be left inside the body, and that's a much bigger barrier to entry and a lot more testing that has to be done, and so that's what we're working on now, and but we've made some good progress, and we're but it never ends. There hasn't been a moment of just like, all right, we can.
Well, no.
Yeah.
Why would there be? It's to me, that seems like, I don't know, self-evident that it's just always it's an ever unfolding, ever expanding field, right?
Yeah.
Of knowledge and application. But I want to ask you, I know I definitely want to get off at Metro Center and get on a different train, and because there's so much territory to cover with you, Matt. But before we do, how does give me an example of what happens to give you clarity on the direction that the company goes in? I imagine it's organic, but how did you know it was going to go into this new side of putting something inside of a body and leaving it there? Like, how did that show up? Is that something you hunt for? Does it arrive? I'm just curious. How does that unfold?
Yeah. And the way these things unfold, like for lots of different startups, I mean, it's the hope is that you've got a CEO founder that has a really clear vision and a really clear vision around building something to fulfill an unmet need. And when I started the company, I called myself CEO by default. There was no one else to be CEO, so I was the CEO, scientist, founder. And the way I thought I was getting to finding unmet need was reading things, going to conferences, talking to people, and talking to regulatory people as well, because part of it in the medical field is, it's not just simply what's the unmet need, it's what's the unmet need that's achievable to get with whatever funding you can get to go and get that regulatory approval. In the early days, I thought the center of the Venn diagram was actually vascular access procedures, meaning, people go in and get cardiac procedures every day. They'll get catheters stuck in their wrist, and it goes down here and goes into their heart. They get imaging, and then they pull stuff out, and then you have bleeding that you have to manage. And that was my first regulatory clearance, was around a patch for that. And to me, I thought what I knew of the market, it sounded pretty big and seemed legit. There were big companies in the space, but the reality is, once I got it cleared, it was like it became evident that it wasn't that big of a market, and that there wasn't that much new opportunity for a patch, a freeze-dried patch. But what that did do was give us some regulatory lineage, where we could then use our own technology to start using that as the predicate device to get the next thing. And I did have that vision that, like, hey, even if I'm wrong about the market, if we can get some regulatory traction, I can then get stuff cleared in other medical device markets and talk to different commercial partners along the way, and see where the most commercial pull is. And that's essentially what happened. The most commercial pull was in the direction of an over-the-counter gel, and there's lineage off of that gel from that vascular access patch that first started. And so it's like you have to particularly in life sciences, you have to be able to write a vision on paper, in the form of a business plan, but also be prepared to to pivot your unmet need as you actually go and talk to big companies and other people that really understand the market. Because that was the disadvantage I had at the beginning, was I didn't know the market. I was just a scientist, right? I wasn't working in the field. I wasn't going and selling medical products to through distributors and stuff like that and saying, oh, this is a really hot field over there. I can see that this set of products sells much better than the other. I was guessing in a lot of ways, but I was doing a lot of the fundamental right things of submitting patents, submitting papers after submitting the patents to get kind of some peer review and credibility and height for the technology, getting grant funding to build research programs and do testing that could lead to regulatory approvals. And then when you get the regulatory approval, it kind of goes back to my thinking in college. If I just get a good job, there'll be if I just get good grades, there'll be a job on the other side. In the case of a regulatory approval, it's oh, if I just get a regulatory approval, there'll be acquisition or commercial partnership on the other side. And I was some ways equally wrong about both, and in other ways equally right about both. That if you actually do go get a regulatory approval, it's an immediate talking point for any small company, big company, commercial partnership. And so that it was just by doing that I ended up kind of navigating towards a good outcome. And then also recruiting on there was a Maryland guy that I ended up recruiting on who had a lot of fundraising experience in life sciences. And he really led our first actual fundraising, with investors, not with just grants. And that's where we became a real company with real money in the bank and real, an ability to hire a lot of people. And so, yeah, I mean, it's I don't know if that's a good answer.
No,
I
follow.
It's kind of like anything in life, is that you sort of, while vision matters, it certainly matters. You kind of have to have some activity and do some things, right? Even if your strategy wasn't perfect, if you go execute on the imperfect strategy, at least people can see that you can execute and that you're building something.
That's right.
And if you can figure out how to pivot it into the perfect thing, as long as you're executing along the way, people will take notice. But the perfect thing, which it's hard to achieve perfection, but it's a CEO that's bam, I know this field, I know there's this clear unmet need, I know how to plug in the right technology to fulfill that need, I know how to raise the money for it and put together a team from day one. But that rarely happens. And people, even really sophisticated people, are often wrong about unmet need. At the time that I started doing all this, by the way, no one, here you can see it now. No one would have thought this would do anything. Gel in a tube, who cares? We've got Band-Aids, is kind of the thinking. And it wasn't until a commercial partner said, that's what we want, where it became real enough. And they had that vision. We had the technology to basically backfill that vision. And we had to execute on the regulatory approvals and actually go make the product and set up a manufacturing space to make 100,000 units at a time, which that was not easy. So
that does beg that question. So I have to, I confess that there's a part of me that wants to plow ahead with that inquiry on, tell me about the story of acquiring that manufacturing setting, and so that you can have liftoff with this, potential boost in the company's growth and fidelity to its vision and all that. And then another part of me is like, I've been holding in this question about wanting to know Matt's like entrepreneurial origins, so I don't know which one feels right, but just, I guess you can answer either one you want. So this other question is like, what's something in your life in any of the chapters of your autobiography where you can point to and say, yeah, that's where my entrepreneurial nature, I became aware of it, or that's where it began to kind of gain momentum, or I was more clear on having the courage to make mistakes and start something from scratch, et cetera, et cetera. So either way, because I'm curious either way, with the manufacturing story or going back in time.
It was, I mean, in college, I never thought I would start a company. Like that was not like a thing anywhere in my sort of ether of thinking.
Did you ever start a lemonade stand in elementary school? This is what
I did do lemonade stands as a kid at some point in time, and but I never viewed myself as a business guy. That's for sure. Actually, okay, you made me think about the right answer. And before I give that answer, though, one thing I do want to note is that whole moment coming out of grad school, even though I did have some great research mentors in Dr. Ragavan and Dr. Hess, like they weren't, like Dr. Ragavan actually was like, he didn't want me to start a company. He thought I should, a lot of professors want their students to go into academia because it maybe better. But like, he was like, a company, why the hell would you do that? So there was actually quite a bit of like
pushback.
I was sort of going against the grain even more than you might imagine in starting a company. I was weird, if that made, like, there was no one coming out of the engineering, like chemical or bioengineering at the time that were going and starting companies. I was a weirdo. But I think the moment, what led me down the entrepreneurial thing, thank you for reminding me of this. I remember, like, it was senior year of college, and I was like, I'd made kind of a late decision to go to grad school, and like, yeah, all right, that's what I'm doing. I'll make like $25,000 a year studying, and I'm going to be, starting a band and doing things like that. But there was like this kid I ran into, or I hadn't seen him in a few years. But like, he actually did engineering to start out with, and he quit. I remember, like, it was like sophomore year, chemical engineering. That's where it gets real. Like, and like the first tests happen, and like the first tests are brutal. And I remember, like, after the first test, like the class after the first test, like half of the people were gone. Half of the people quit, and this dude was one of them. And he went into the business school, and I hadn't seen him, but I saw him here and there, like partying his ass off. He's like, yeah, business school is awesome, man. Like, I'm so glad gosh, best decision I ever made, and I'm having so much fun. And engineers are kind of like intellectual elitists. It's like, I'm working really hard on a Friday night because there'll be reward and glory for me someday. It's kind of like how engineers sort of think about it. And so I run into this dude, like, senior year. It's like, hey, what are you doing? It's like, yeah. And I know that he like didn't do that well in school either. He like partied pretty hard. He's like, yeah, I got a job. I'm like, okay, that's awesome. Like, where are you working? He's like, yeah, I'm working on Wall Street. I'm going to be making $130,000 a year or whatever. To me at that time, it was like, what?
Yeah.
I was like, what have I done with my life? and it was a moment for me to like say, wait, I guess society kind of values business people more than it values technical people. And I didn't, that was the first, that's how dumb I was. And
it's an aha,
like that I found this out. It's like, oh, I guess society thought, so I need to learn business things. So while I was going to grad school, I was reading a lot of like business kind of books and entrepreneurial books. because I felt like if I understood business, I'd be more valuable. I wasn't necessarily thinking become an entrepreneur, but as I started reading these books and getting more involved in these things, and having this drive to take my research further than just a paper or a conference or whatever, that's where I was like, oh, if I started my own company, I'd really get to learn business, right? And so I that started becoming a desire, and then later a reality.
Yeah, that's cool. Thanks for sharing that story, Matt. Yeah, so I'm gonna, because we're at where we are, almost 2 o'clock here, we gotta switch trains, if that's cool with you. Is there anything? Is there any other burning information that you want to share with our audience about?
Oh, well, you did ask me this thing about manufacturing, and the key point about manufacturing is we had to figure out how to set up our own manufacturing for the raw material, which is a chemistry on chitosan. We actually talked about outsourcing it. We couldn't find anyone that would do it for, like, doing outsourcing generally is very expensive and kills like your cost of goods, meaning you're going to pay so much to have it made that you'll lose money on. So we figured out how to do it at scale. So we took the chemistry from beakers to massive glass jacketed reactors and put all that together in the space that we moved to after the incubator space. And it was a big journey. You know, we still do that. That's being made right down the hall for me today. And yeah, it's getting a lot of equipment and doing a lot of validation, and it's a lift, but that's how we did it.
Wow. Yeah, it takes a lot of courage to start something from the ground up. Yeah, there's a lot of admiration for that courage. Let's let this be a rhetorical question so we can get on the green train, the green line, or whatever, which is, the rhetorical question is, I do wonder about doubt, fear, second guessing, things like that along the lines, because it's such a, I don't know. It's, to me anyway, and maybe this isn't true, but from the outside, it feels or seems risky. But as you tell the story about, educating yourself in business, it seems like there was a lot of confidence or trust. Like, you know what, this is going to work one way or another. And just
there's plenty. I mean, to tell you all the moments of doubt, fear, and real risk. I mean, I'm talking about, making the wrong decisions on bringing some people in, and then people being adversarial to the company in real ways. There's a number of cases of that, and I was not prepared to deal with that. So there's tons of moments of fear and doubt, and then it's kind of like, I remember, like any PhD student, when you're doing your PhD, people will always ask, oh, well, when are you going to finish your PhD? And it's a very sensitive question, because in the PhD student's mind, they're like, probably at the time you're asking them, we're probably thinking, I don't effing know. I thought it was going to be, next year, but now my research advisor is telling me this or that. Like, I don't know what to tell you, man. And for this, I mean, if you could imagine, I was doing it for years. Oh, when are you going to make a product, or are you guys making any sales? Well, no, not yet. We still need to get FDA approval. Oh, when are you going to get FDA approval? Well, we need to raise more money to do this test and this and that. I mean, that was everything. And I mean, it still is today. The difference with today is we do sell a lot of products, but with respect to new things that we want to get through FDA, it always takes a million, just, the non-linearity to it is terrible and painful. And but what's amazing too, what gives me more confidence today, I've heard people say stuff like this. It's like, and it sounds really simple, and so it makes you not really want to take it seriously. But it's worth saying. It's like any aspiration is delusional until it's actually achieved. Once it's achieved, then it's like, it's just in the rear view mirror, and it's like, and you as the person that achieved it, it becomes really easy to forget how you could have been even doubting yourself, and others could have been doubting you. and all of that could be very legit and real doubt. I mean, any critiques or doubt around my company going from day one to day of like, big commercial milestones and stuff, they had legit doubt. They had legit reasons why they thought I can do it. In the early days, actually, I'd one competitor company that I was trying to potentially maybe get some kind of partnership with, but that company ended up being adversarial and later went bankrupt, which I felt sort of vindicated by. But their CEO, who's an experienced dude, talked to me as this little CEO and was like, "There's no way you're going to get an FDA approval." He's like, "You're making modifications to that molecule, and it's going to be regulated as a drug. It's not going to be regulated as a device." He's like, "I've got 6 PhDs on staff that are all telling me the same thing." Like, what was I to know that I hadn't gotten an FDA approval at the time? I hadn't been through it. We were still yet to put together a package to submit to FDA. Mm-hmm. So it's like, should I believe this guy? Like, I'm trying to figure out if this is worth my time too, right? Mm-hmm. But he was wrong. Yeah. so it really is like, I mean, it is, George Michael was right. You got to have faith. You really do. You have and when I think about challenges that I deal with today, it's like, what makes it easier to have faith for me is to know that, like, that point about it's delusional until you're over the line. Mm-hmm. Once you're over the line, all the doubters just disappear. They're gone. It's like they die, right? Now, if you fail and you fail and you're in a pile of blood, they'll all laugh at you. But that's typically not what happens. It's typically if someone really wants to make something happen, there will be some form of achievement in a way that kind of made it worth it. But you don't know how long it's going to take. That's the unlinearity of life.
Yeah, that's right.
But once it happens, and the long, arduous journey could be 50 years, right? It could be whatever. I mean, it could be an insane, ridiculous lifetime amount of time. But once it's achieved, all the doubters just evaporate, and it was like they were never there. Mm. And then it's like, oh, way to go, man! I always believed in you. That's kind of how it goes until the next challenge where you're being doubted, which I'm in one of those moments right now. But I'm hoping to survive.
Well, I'm grateful it was not rhetorical. I appreciate that answer, Matt. Let's pivot here to Matt Dowling, the musician. And if people want to hear you've done other shows and talked about stuff, so we don't necessarily need to, what was your first instrument kind of thing. But like, I do want to hear you, like, how many bands have you been in?
Yeah, that's a good question. I was actually trying to have a conversation the other day about how many releases have I done with which, what it comes, a band is simply this vehicle, right, that puts out these documents, which we call albums. So the band in and of itself is almost like an album, but a super album. But I guess the answer is 9 or 10, somewhere around there.
Yeah, 9 or 10 different bands. And how old were you when you were in your first band?
First real band, like really, you could call
a band that played in front of people instead of just got together at a house and like covered songs.
Yeah, band that played shows. I guess, middle school. Yeah, but it wasn't. But that band didn't make a record. I think it really high school, like, call it. I'd say 17 of like a real band that can make a record. 16, 17, but a band that recorded something and went and played shows.
Yeah. Uh-huh. And what, how many, okay, now, how many bands are you in right now?
3.
Okay. All right. For listeners, what are those bands?
Swoll is my main thing. That's what's coming out here soon, or I'm most active with now. Burial Waves, which is releasing a record later this year, which is kind of a loud rock thing, with a bunch of old friends, and then How, which How with 3 question marks. That is that's me and this dude Alex Tebelev, who's a big DC house show guy for a long time, and did a band that got pretty popular in DC and regionally.
Paper House.
Yeah, yeah, and I ended up playing in that. I mean, he had started it it's going on for many years, but that band meant a lot to a lot of people, and so he's largely producing, but How is like our co-production, and we do shows off of it. So
Okay, so Burial Waves, How, and Swoll. Let's start with Swoll, since that's the now you're this episode's not going to come out until your album until after the album releases, which is, you said, in a couple days. What's the name of the album though?
the name of the album is Avoid Attach.
Avoid Attach. So yeah, I'm very, very curious. What was it like conceptualizing this album, putting it together? I mean, you know, again, there's a bunch of like, even my like interviewer part is like judging me right now. Like, come on, man, you're really gonna ask that question? But I really am curious. How did you just tell listeners a story about how this thing came into being that's going to be released in a couple days?
Yeah, thank you. Well, and I always start with music first. That's just how my background is largely as a bass player. Most of those 9 or 10 bands, I was the bass player in.
Mm-hmm.
For Swoll, I play bass and sing live, but I really do all the writing and at one point all the instrumentation on records. Now more as a band with this dude Eric Slate, who I've been friends with forever, who plays drums and does kind of some electronic elements live. And Eric's voice on this record shows up in this record more so my last stuff very much feels like a band in a room, whereas the first stuff was like bedroom recordings or like productions using computers and that sort of thing. Which Swoll, the whole thing about Swoll was like me kind of proving to myself that I could write songs in total and write lyrics,
Mm-hmm.
and sing. I mean, I did backup vocals prior, but I never viewed myself as a singer. That was actually a big lift for me to even do the first record, to get over the hump of saying, okay, I'm comfortable enough to write lyrics and to sing on recording and be comfortable enough to release that into the world. Mm-hmm. That first record was made without any shows prior. It was just a recording first. And then I started doing shows after. And so like, I guess just singing and making melodies happen and that sort of thing, that seemed achievable. Lyrics were a lot harder, and I needed some kind of framework to work with. And the best framework that I had is really psychology. And I mean, you're a psychology guy. For me, as time goes on, I become more and more interested in psychology. I remember like in college, going back to, like some of the college times, like the engineers will like laugh at the history and the psychology majors for being like the kids that don't know what they want to do. But as time goes on, I'm like, man, psychology maybe the most, and history maybe the second, are the most important subjects. Those are the absolute most important subjects, because if you understand those things, you understand people. If you understand people, you can kind of get through life, or make life work for you a little bit better than it would otherwise. And so I think about modern psychology, and so like Swoll in and of itself is a reappropriation of a term that is a funny term, right? Swoll is swole dude at the gym kind of thing. But
Yeah.
it's this bed of like of how in the modern world, and like our current modern world of, call it the last 15 years, like everyone's kind of flexing, right? Like, and social media is like a big thing that drives all this. It's like, for you to go, I mean, think about like 30 years ago, right? Or 40 years ago, whatever. Like, no one was thinking about like, what do I need to post today? I mean, like, no one was like, and just the concept of posting is like, it's like, well, if you're going to put something out there, you have to show off a little bit. You're like, you want something to be proud of. So like intellectually or like, you know, emotionally, you want to flex a little bit. Doesn't mean you have to be a muscle dude flexing in the mirror, but you could be a, you know, woodworker who's proud of their woodworking thing, and you're posting about your woodworking thing, or your you know, new piece of clothing, or whatever it is. It's like, it's all of this flex, and like, and then how that relates to modern psychology and like modern relationships and that sort of, that was my whole bed of like coming up with lyrics. And I mean, part of it was relating stuff to my own life and my own experience, but it's important to say psychology, because you lit up a little bit when you heard what the album title is, Avoid Attach, and you're a psychology guy, so you immediately know I took that from the term avoidant attachment syndrome, which is, I guess, maybe not considered a psychological disease, but it's kind of considered a condition. And that condition is one of which I have said this in a couple of things I wrote up around the album, but there's this dude / band from Athens, Georgia, called Of Montreal, and the singer's name is Kevin Barnes. I really like a lot of their records, some not as much. Kevin Barnes is known to be a little bit of a jerk, but he's an artist, and I'm sure he has like plenty of good moments. And he has this line that I love, which is, "I need you here and not here too." And that's like what avoidant attachment syndrome is. It's like you want, it's the classic syndrome of the artist or the person that's like into whatever they're doing. I'm working over here and I'm like absorbed in that, but I still want the relationship, you know, and in some respects I'm working over here because I almost want to protect my partner or whatever from me, you know, because I'm there's like a self-hatred about it. But you know, the like the classic thing of like avoidant attachment is like whatever, like musician, like a musician, or just like whatever dude being like, man, I wish my girlfriend stopped bugging me. Stop calling me when I'm trying to work on my shit, man, or whatever, you know, like this is, but so I'm playing with this term, avoid attachment, to a verb, avoid attach, as to talk about something in the very modern era. I mean, geez, like the AI era, like that we're getting into, is like, that's what everyone is, right? We're all here and not here too. We're on social, I'm communicating with you on social media. Like, you're keeping up with me, right? Like, we're on social media. It's like, it's not really keeping, it's like, you're just seeing this like flexed version of me, or maybe not, but regardless, it's like there's a distance, right? We're together. You're here. You're seeing it. You're looking at my story every day, but we don't know each other, you know? And like, and we're also, and we're also like, you know, there's no obligation to even try to know each other much more than that. These are kind of the social norms that are starting to develop. So I'm exploring this term of avoidant attachment. By the way, I've been accused of being avoidant attachment style. If
color me unsurprised. not from what I know about you, but just that's like, why else would it be so gripping and compelling and say, I want to play with this idea, I want to like go into the fucking lab and find the lyrics, like ask my soul, what do I want to chew on, what do I want to share, what do I want to put out there and be seen, you know?
Yeah. My bandmate Eric, who's bitingly sarcastic and funny, when he saw the name, when I said it's called the Avoid Attach, he was like, oh wow, he must be emotionally unavailable or whatever. I was like, dude, like like he made me feel bad because it made me feel like it was like too obvious of a title. But thankfully, so far, like the response that I've been getting and like some write-ups that I've seen and stuff, like I think people like it. I think people are like appreciate it because I think a lot of people like think about that term, and maybe a lot of people have been accused of being avoidant attachment because I think it's kind of part of being Swoll too. The whole Swoll thing is like I'm embracing that whatever I do 5 different things, whatever, and a bunch of businesses and stuff. But kind of everybody does, right? We're all doing a lot of things in the modern world. Like everyone's kind of swollen to the gills with all kinds of different things, and therefore something like avoidant attachment style is like more of a cultural norm. And part of what I always say is like, is that a good thing or a bad thing? I mean, like on its face, like it should be bad, right? Or this concept of I need you here and not here too. That seems like distant and bad or whatever. But maybe it's not.
Well, let me just say, Matt, I lit up because I was like, oh yeah, I already knew the answer to that question because I had done a little bit of I'm listening to music, in the days up, preparing for interviewing you and having a conversation here, and I was like, oh yeah, that's right, it was avoid attach. But I actually didn't put those things together. I remained open-minded and curious and like, okay, what is that? Avoid attach. What is the story behind that? Which I still would be, by reading the lyrics would kind of learn more about and appreciate more. But something I want to say just about whether it's good or bad is it's kind of, well, neither and both. It's like neither good nor bad, and it's also both good and bad. So just hold both of those paradoxes that conflict. And a fun fact for listeners is that I've been doing couples therapy for over a decade, and the different attachment styles, like the avoidant attachment style, like the most common for heterosexual couples, the most common cluster of the couples that come into therapy are, well, one partner's an avoidant attachment style and one partner's an anxious attachment style. And these two lovebirds have exactly found the exact person who will optimally grow them the fastest, but it doesn't feel that way when they're feeling betrayed and they're suffering and they're on meds and blah, blah, blah. But literally you put these two attachment styles together and it's like two reactive elements or something. It's explosive, right? But I frame it that way because it's like the person who feels anxious and is like, what is my partner thinking? Like, do they love me? Do they care about me? Like, I need to know, and the pursue, or demand, whatever you want to say. Like, that's exactly the energy that the person who's labeled, and I don't like the labels, but we'll just stick with them for now, who's labeled avoidant, that's exactly the kind of energy that is provoking the avoidant energy the most. It's like, so when people come in to heal and to transform, and they have that partnership and that style, it's you are working with each of those partners with what are they getting triggered by, and what is it that's underneath of the behavioral response to pursue. I can't resist. I have to. I'm impulsively texting my partner, or I just have to get away. I'm not going to answer the phone. I'm going to send you to voicemail, whatever. Like what is that in service of? I could nerd out and I won't, but it's very, there's maybe the short punchline to that is underneath of those attachment styles is an unmet need, right? It goes back to that. It's like, it's the unmet need, and the behavior is a positive intention to protect the individual. Sometimes it's a positive intention to protect the relationship as well. But yeah, anyway, there's people transform in those attachment relationships, and they'll break up with someone and they'll find that the next partner is like the exact same. They're just back in the dance all over again. So like the mistake is like, well, we got to fix my partner. It's like, no, dude, you turn and you've got to heal yourself. You have to heal yourself. And then when you do that, then you will learn, oh, this is the fear that's been driving the anxious demand or the avoidant withdrawal, Anyway, there's a lot to this. I don't know if I'm making sense, but
so you're actually a great guy to talk. I should actually like interview you to get like lyrical content for my next thing. But am I right in my guess that like avoidant attachment style is growing?
I don't know if it's growing or not. I don't know. But I could understand.
You see it a lot. You see it a lot.
Yeah, it's the in couples therapy, the most common couple profile is one partner is of quote unquote avoidant, and they have found themselves mixed with a partner who is quote unquote anxious. Those two styles are drawn to each other magnetically, as if the wheel of karma and the Godhead universe is like everyone's incarnating and learning their spiritual lessons. It's as if like this person will grow you the fastest or completely destroy you. But again, who's to say that's not growth? Again, there's a lot more to say about it. But I easily could tangent on that, and I probably already have, but I do want to, I'm happy to answer any questions you have, but I do want to.
Okay, so that's the most common couple that seeks therapy.
It's what shows up the most. It's what shows up the most. Yeah.
I mean, okay. That's interesting. Awesome. But yeah, so that's where that title came from, and that's like I need something to go off of that feels like that I feel interested in, and I guess inspired by to a degree to be able to write lyrics, because writing lyrics is hard, it's a lot, and it's the last thing I do for any record, and it's like it's I find it to be the hardest thing, but once I get rolling with a concept, then it all comes together and feels fun, but it's like it's a chore. It's a chore for me to have to write lyrics. So I need something that makes it feel like less of a chore.
Right. Yeah. So, and I'm curious, for this album, Avoid Attach, you were contrasting like kind of just like in a room and studio and like doing software and stuff. Like where was this recorded?
A lot of it was tracked in a studio in Philly. Mm-hmm. With a guy, his name's Dan Angel. He's a longtime Philly dude. He's played in a bunch of Philly bands and has had a few different studio spaces. This studio is kind of near Temple in North Philly, and just a really cool space. And Dan Angel's done a lot of really great Philly records, and he gets a lot of just cool sounds and so tracked there. Some of the pre-production was there. And then Alex from How mixed it.
Cool.
So yeah.
Cool. Well, this question sprang forward, which was, you mentioned how in the first album for Swoll, you never performed. You like the first show that you ever had as Swoll, you already had the album, at the merch table, right? And this was your first band where you were the front man, the lyricist.
Yeah.
And I'm very curious, after having been like bass guy, background vocals from time to time, and also like very versatile, happy to jump in and be like, oh, your bassist like got sick on tour, I'll fill in or whatever. Like you've participated, you are no stranger to the music scene. So you're not scared to be on stage. You've put in your time. Okay. But now you're the lyricist. They're your lyrics. You're the front man. What was it like for you, Matt, at the first show performing Swoll songs?
Oh, well, it's kind of amazing what you just said is that I just thought back. The very first Swoll show was opening for the Jay Robbins band at DC9. He asked me to play, or he would like I was talking to him and he was like, I need a band for this thing. And I was like, the timing was kind of lining up with, okay, maybe we can pull off a show and like, let's do it. So we did it. And I was actually like fairly excited about it because we had a good vision for the first show, and the first configuration of the band was just me singing, and one dude, Ben Schur, who then really helped produce my very first stuff, like bedroom recording stuff. He was playing bass, and then Eric was playing baritone guitar. A lot of the early stuff was bass and baritone guitar, playing these really kind of simple licks, but were sounded really like cool together. And then electronic drums. And so the electronic drums and tracks were coming out of a wall of amps. So we set up this wall of amps off to the side of the main stage. We set up a guerrilla style own thing, this wall of amps with like special like subs, like pumping out like low end stuff. Eric and Ben playing stringed instruments that are like blasting through these big amps. And so, and I was just singing, which like
no instrument on your shoulder.
no instrument on my shoulder. And I was like, I was pumped about part of like my inspiration for Swoll too. Is like, there's been like a lot of rap and hip hop that's inspired me throughout my life.
Uh-huh.
And I started getting really jealous of rappers and like in the late 2000s, 2010s, like, wow, like these guys can crank out like an album. These guys are cranking out an album like every month or whatever. Like it takes us as a band to write, like 3 years to write a record or whatever. And so there was this early part of it where it's like I almost viewed myself as like an MC or something like that, but it was still like rock based. But it was once it's all done like that, then it's like it's kind of like singing karaoke over your own thing. So it's kind of easy actually. It was sort of fun and exciting and easy. And I was pumped about it because Swoll does this visual thing too that we set from the beginning that I was like very enthusiastic about. And so people really liked it because it was something different from me and like it felt different. So the very first show was great. What ended up happening though is that configuration of show started getting boring over the course of time with just a static track playing. Like, okay, the track's playing, and then it's like it's karaoke, right? And I mean, there's lots of things in the major music world and independent music world even that are that, right? I mean, like rap basically is that. Rap is like the rapper gets on stage and they press the laptop and the beat is happening in the music and then they jump around, they're rapping, but it's basically karaoke. It's very static. And what ended up happening was we toured off of it, and we toured late 2018, which is like when that record came out. Then I had another record ready. 2019 we toured more, but Ben, who was playing bass, like in the middle of a tour, he got angry and tired and quit the band.
Yeah. By the way, that's the first time that's ever happened in all bands touring ever. Oh, wait a minute. No, it's like I can completely. Yeah. Anyway, yes.
He got angry and tired and quit the band, and we had 10 days before the next leg started. And Eric, he's not really a drummer. I mean, Eric, he's become a drummer through this, but like. He's like, okay, we had to sit down the next day and be like, what do we do? Like how, I was actually just thinking, well, we'll just throw the bass parts onto the track and just like, you keep playing baritone guitar and we'll just do the same thing. He's like, well, why don't we try this? Like I've been messing around with this drum thing where we can have tracks going through this one machine, but I'll have like some acoustic elements and some triggered elements, and you play bass and sing. And I was like, we got 10 days to do that. But we did it. We practiced, we pulled it off practicing every day for 10 days. And I will tell you, going from singing the songs, even though I'd written them, to play and sing and do all that, like it was a lot of work, but we somehow made it happen. We weren't that great at it starting. We were good enough to pull off a set doing it like that. And then we did this 2-week tour off of that, And then that's been the configuration ever since. And it's much more exciting today with that configuration. And I'm happy, you know, that's the gift, right, of someone of a bandmate getting angry and leaving you, is that he forced us to change in a way that we actually really needed to change to make the live set be just bigger, you know, more something to talk about. And it's definitely more something to talk about today.
By the way, that like, I want to just like clip that headline, like forced us to change in a way that we really needed to change. Like my mind immediately went to like all the people on couches, like healing and therapy. It's like when you go over back in your biography, your autobiography, it's like, yeah, that sucked. You know, it's like what the rabbis say about we're all too foolish to recognize the difference between blessings and curses. So just treat everything as a blessing, you know, like in the moment you're like, fuck, okay. But like now you're like, I'm really grateful that happened. Right.
Yeah.
Say more about the visual. So the visual element.
Yeah. This dude, Zach Forrest, who I knew from like DC house show stuff. He was this guy doing this really interesting stuff with laser light. And he'd come and he'd just come to house shows and like do these like laser light shows. And so I met him through that. I was like, man, that's cool. And then as I was gearing up to do the first Swoll shows, I was like, hey, I want you to be like, I want you to do lights for my shows. I want you to be like a band member, you know.
Come on tour with us.
But you're a band member, but what you do is the visual element. And so it's this really cool laser light thing. It's not just lasers. It's like, it's lasers reflecting off of these like nifty things. Just create, like, you have to see it kind of thing. But it's like, it really does help the live show. Like, it, for someone who's seeing it for the first time, they're just, you know, it just hits. And he's a great dude. You know, has just done a lot with visual arts, and it's been great to have that visual piece of the band. So it's dark on stage, and then you see these laser lights kind of like fan out during the set, and it bounces off of whatever space it's in. So any space you're in, it's like makes it unique in a way. So
now, what explains the gap between 2019 and 2025 between full albums?
What are you, a job interview?
That's right.
A job interview.
What explains? I don't know if we should hire you for our tour. Yeah. No, I'm following my curiosity.
You're hitting.
I hit a sore spot.
This is actually a good interview lead in. But you know, you're hitting me where I'm self-conscious is. I should have gotten it done earlier. And I've continued writing a lot of music, but I couldn't make it happen. And my excuse is, coming out of COVID, I mean, I'd written stuff during COVID. I went through one very difficult personal thing right at the beginning of COVID, that made me kind of want to step away from music a little bit anyway, even though that made it easy, because COVID killed music, or killed live music, for a year and a half.
Yeah.
Right coming out of COVID, late 21, I did release a single. It was the single's called "Pass Through the Fire." So I recorded the song, made a video for it, did some shows off of it. And from late 21 through early 23, about, I was pretty active. I mean, I was doing a lot of like good regional shows consistently. And I was like, it actually would have made a lot of sense for me to release something in 23. I was still working on the record. And I think the thing that held me up the most is Hellbender, is setting up the vinyl plant. So I was doing all this work, setting that up. There was also a few other things really pulling on my attention. I was also gearing up to do the Howl release. The Howl release is 2024, and finishing that record. And that I was working on that with Alex as well. So things got kind of backlogged, and it's amazing. Like, if you're not really on it, time just passes so fast. And so I lost some focus, but at the same time, like, I felt like I gave the whole thing enough time to like let the record come together in the right way. I'm really happy with how it all turned out. Like if I'd pushed it out way earlier, it wouldn't have been the same thing. Yeah,
Listen, it's been since 2014 since I've released a full album. Okay, so if I get asked that question, I'll be like, yeah, what happened to those 11, 12 years or whatever? It's all, now people don't know. You said Hellbender. Let's tell people, because we were talking about that a little bit before we went on air. So what's Hellbender?
It's a vinyl manufacturing plant, so vinyl records, and like I knew, like I've been a customer of, you know, buying vinyl to sell at shows and that sort of thing. So I know, I firsthand knew about, like, okay, it's been coming back for a while. And it was actually during COVID that I reconnected with this dude, Jeff Benton, who runs a label in Pittsburgh called Medcura Records, and they had released a record that I was on, and I kept in touch with him over the years. And he had mentioned wanting to start a vinyl plant, and there's a lot of people in my network that were like, hey, I can't get vinyl anywhere, what's going on? Because 2020 and 2021 was a real, you know, backup of the vinyl industry, and like all these plants lead times going out to like a year plus and all that kind of thing. And Jeff was like, yeah, I wanted to get it started, but I didn't really get it. You know, I had a group that was interested in making it happen, and then kind of fell apart, but I still want to do it. And at that moment, like, if you can think about like all the stuff I do now, at that moment it was really just Medcura. I wasn't playing any music. I wasn't doing really any other life sciences stuff. So, and Medcura had gotten to this point where it kind of started feeling a little easier. And as I learned about what vinyl pressing is, which is really chemical engineering, it's like heat exchangers and steam, you know, production and cooling systems and plastic extrusion and all that. That couldn't be more front and center chemical engineering. And I always had this like, oh, like I never really used my chemical engineering degree. And I remember the stuff, plus it's music, plus it's business, plus it's entrepreneurship. So it's like so much of it felt like it was calling to me. Yeah. And I dove in, you know, I basically, I signed up in 2022. I signed a lease on a space in Pittsburgh, late 22, and started building out a space. And I mean, even the setup, I was able to pull a lot of it off remotely, but there were times I had to go there and, you know, be there for longer periods. But it's worked out, and I'm really proud of what the company has achieved. It's a great brand, if you will, and it's all built around like people who are musicians that understand the pain points of musicians and labels, and are willing to go the extra mile to get stuff done for people's tours. And it's very common in the vinyl pressing industry that like the people that are making the stuff, they're like, they don't care about the deadlines of the artists and the labels. It's just kind of like, you get it when you get it, you know?
Well, and also aren't the artists and the creatives not the most time management and organizational savvy? So you're probably running into a bunch of people with expectations like, hey, well, you only told us about this is when you're going to get it. So you have to just, you know, it's kind of like a rude awakening for that personality type.
Agree. Yeah. So, and that's part of what we do too, is we like sort of handhold the musicians to help them define deadlines for themselves. And oftentimes people need help getting like graphic design stuff done and like templating done. And we do that, right? So it's almost a customer service based company first and a manufacturing company second.
Well, this is endlessly fascinating, Matt, and I have a bunch of other questions, but I do want to respect the nature of the human bladder and the time boundary. We all got other stuff that we need to get to before we go. Maybe we could just I think I'd like to share a song on this episode, so I'll do that in post. Obviously, I've already shared Scar, so maybe I'll share something else, another track from the record, but. This is going to come out October 12th, And I guess you all will be in Charleston on the 19th. In Charleston, South Carolina, Richmond, November 4th, Baltimore, Maryland, November 22nd, and Washington, D.C., December 4th. I would love to go to both of those shows, but I have an affinity for just Wonderland Ballroom. I just haven't been there in a long time. I've never been to the Bogus Gallery. But yeah, I just want to plug
Awesome.
the band's shows. And yeah, thanks so much. Thanks so much for coming on. And how can people listen? Where can they find you?
Yeah, I mean, all the common platforms, is much bad press as, or I mean, there's real reason for the bad press, but Spotify, right? Most people listen to Spotify, Apple Music, that sort of thing. It's all there. And then, you know, my website, which is swollmusic.com, that's the headquarters of where all the stuff is.
And you got music videos on YouTube. They can find those music videos on your website too.
Yeah. For sure.
Cool.
Yeah.
Cool. Well, thanks again for coming on the show, Matt.
Thank you. Yeah. Thank you for having me. And yeah, like, it's amazing that like we like you've done a ton with your show, and you've had like a bunch of people, and like way outside the scope of little old Olney, Maryland, you know, but that's where we know each other.
Yeah.
And so it's great to catch up. So I hope to see you again soon.
Right on.